Hi, I'm Natalie Lupiani, a Vice President at the Benenson Strategy Group. In this edition of the BSG Telescope, we will be looking at the impact of COVID-19 on our mental health, the effect working from home has had on our psyche, and how small changes to your routine and interactions can make a very real difference. We know all too well what lengthy pandemic has cost us, hundreds of thousands of American lives and the livelihoods of so many more. But the impact that is often unseen and unheard is that on our mental health. To be clear, mental health in this country was an epidemic well before the pandemic, but COVID has made matters much worse. BSG knows that mental health is a top priority for most Americans. 3/4 of us in this country, in fact, say it's an important priority. In a recent BSG study, a whopping 79% of all registered voters said that the situation with coronavirus has affected their mental health, including 39% who say it has affected it a lot. Those percentages are staggering. This crippling of our collective mental health is no doubt due to a variety of factors ranging from loss to isolation to frustration. But as we look beyond the obvious reasons, we see that our new workplace, for most of us, a makeshift office in our home or apartment, is largely to blame. In the employee research we've conducted, people in the workforce tell us they feel isolated. They miss the in-person connections they normally enjoy in the workplace. Boundaries is another source of consternation. Employees at all levels are having greater difficulty setting those boundaries that let them do their best work and enjoy and fulfill their lives outside of work. We've seen these troubling themes arise in our research over the past 6 months time and again, and we aren't the only ones. A recent Oracle and Workplace Intelligence study found that 7 out of 10 people said that they had more stress and anxiety at work this year than any other previous year. And 4 out of 10 people in that study said they are also battling everyday workplace stressors, like the pressure to meet performance standards and unmanageable workloads. In terms of work-life boundaries, well, they're blurry at best. 41% say there is no longer a distinction between personal and professional life. With only 28% of U.S. employees expecting to return to their workplaces by the end of 2020, according to a Conference Board survey, the workplace problem isn't going to go away anytime soon. So what can you do as an employee, as a leader, to better your workplace and help yourself and your colleagues? First and foremost, whether you are an employee or a company leader, always ask for help if you need it. Now is not the time to be shy. Now is not the time to be proud. Reach out to your HR department. Reach out to a colleague that you trust. Reach out to a mentor if you need help. Employees, you must set the boundaries you need. You're not sure where to start? Try scheduling breaks for yourself in advance. Get up, get out, move around in those breaks. For leaders, make time to connect with your employees. Help them keep sight of what is important to them in their careers. Help them stay focused on developing, even in the face of uncertain or unusual work circumstances. And show empathy. Thanks for joining me in this edition of the BSG Telescope. I'm Natalie Lupiani. See you the next time.